In the past, telehealth wasn't widely embraced because many payers wouldn't reimburse it at the same level as an office visit, if at all. Do you think the success of telehealth during COVID has permanently changed the reimbursement outlook for the better?
I certainly hope so, Todd. This is a question that I get a lot. And, before this hit, I think there was a question about whether or not payers were going to pay for virtual care. And I think that question has largely been answered. I mean, we're seeing that payers are saying that they're going to pay for it. And so it's not so much a question of if they will pay for it, but then the next question is this idea of parity. Will payments be equal to what payments for in-office care will be? And I think that's an open question. Um, I do think in order for these gains in virtual care to sustain and for us to really capitalize on this, we've got to solve this issue. And value-based contracting is one way in which this solves it. If you're paying for sort of the total package of care that's being delivered, then the providers are definitely incentivized to provide more care virtually, to provide these sort of virtual touch points with patients that will probably improve outcomes. And within a value-based construct, then they actually have a way to get reimbursed for it. In a fee-for-service structure, we definitely have to think about, how can we incentivize this behavior, and how can we reimburse providers so that they actually are incentivized to drive this type of care as we move forward and not go backwards and lose all the momentum that we've gotten here.